Gabapentin solution is used in combination with other medications to help prevent and manage seizures. It can also be used to alleviate nerve pain that occurs after shingles in adults. This medication is classified as an anticonvulsant or antiepileptic drug. The daily dosage and optimal timing for taking gabapentin solution will depend on the individual's medical condition and response to treatment. It is important to follow the dosage prescribed by your doctor and take it at the same times each day to maximize its benefits. Before you start taking gabapentin, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor. The dosage is based on your medical condition and response to treatment. For children, the dosage is also based on weight. It's important to carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. Follow your doctor's dosing instructions exactly. Your doctor may gradually increase your dose during the first few days of treatment. To minimize side effects, take the very first dose at bedtime. Take this medication regularly to get the most benefit from it. It works best when the amount of medicine in your body is kept at a constant level. Take gabapentin at evenly spaced intervals at the same times each day. If you are taking this medication 3 times a day to control seizures, do not let more than 12 hours pass between doses because your seizures may increase. Do not take this medication more often or increase your dose without consulting your doctor. Your condition will not improve any faster and the risk of serious side effects may increase. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased. Antacids containing aluminum or magnesium may interfere with the absorption of this medication. If you are also taking an antacid, it is best to take gabapentin at least 2 hours after taking the antacid. Different forms of gabapentin are absorbed in the body differently. Do not switch from one form to the other without consulting your doctor. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of gabapentin solution include drowsiness, dizziness, loss of coordination, tiredness, blurred/double vision, unusual eye movements, or shaking, tremor. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risk of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects, such as swelling of the hands/ankles/feet. Additionally, a small number of people who take anticonvulsants like gabapentin may experience mental or mood changes, including depression, suicidal thoughts/attempts, or other unusual changes. It's crucial to report any sudden changes in mood, thoughts, or behavior to your doctor or caregiver. In the case of very serious side effects, such as slow/shallow breathing or signs of a serious allergic reaction like fever, swollen lymph nodes, rash, or difficulty breathing, seek medical help immediately. This is not an exhaustive list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other unusual effects. If you are in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking gabapentin solution, make sure to let your doctor know if you have any allergies to gabapentin or other ingredients in the medication. It's important to also inform your doctor of your medical history, especially if you have kidney disease, mental health issues, or a history of substance abuse. When taking gabapentin solution, be cautious of activities that require alertness or clear vision, as this medication may cause dizziness, drowsiness, or blurry vision. It's also important to limit alcohol consumption and to avoid using marijuana while on this medication. If you are an older adult, you may be more sensitive to certain side effects, such as swelling, breathing difficulties, dizziness, and loss of coordination. This can increase the risk of falling. For children, there may be an increased sensitivity to certain side effects, including changes in behavior and mood. If you are pregnant or breastfeeding, it's essential to discuss the risks and benefits of taking gabapentin solution with your doctor before using this medication. Now let's talk about the potential drug interactions of gabapentin solution. It's important to be aware that this medication may interact with other drugs, which could change how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. And remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with this drug is orlistat. There is also a risk of serious side effects, such as slow or shallow breathing and severe drowsiness or dizziness, if this medication is taken with other products that may also cause drowsiness or breathing problems. It's important to inform your doctor or pharmacist if you are using other products such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines and ask your pharmacist about using those products safely. Additionally, do not use this medication with other medications that contain gabapentin, including gabapentin and acarbol. Lastly, keep in mind that this medication may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much gabapentin solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness, trouble speaking, and weakness. It's important to seek help right away if you suspect an overdose. This medication is prescribed to treat certain types of seizures and to relieve nerve pain following shingles. It is also used to treat restless leg syndrome, RLS. Gabapentin works by calming the overactive electrical signals in the brain that cause seizures and by altering the way the body senses pain. It can be taken with or without food, but it is important to take it at the same time each day. The dosage is based on your medical condition and response to treatment. For the best benefit, take this medication regularly at the same time each day. If you forget to take a dose of gabapentin solution, take it as soon as you remember. If it's almost time for your next dose, then you can skip the missed one. Just take the next dose at the regular time. Don't take a double dose to make up for the missed one. If you take gabapentin 3 times a day to control seizures, make sure not to let more than 12 hours pass between doses, as this could cause an increase in seizures. If this happens, consult your doctor immediately. It's important to store gabapentin solution in the refrigerator and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.